How's it going? My name is Ty O'Connor. I'm in my second quarter of Masters of Coaching Administration. So today I'm going to show you how to do buddy taping with the two middle fingers and right here. First of all, you're going to need tape. You can use gauze in between the two if you wanted to. You don't have to. Some athletes prefer it just because they get sweaty. What you're going to use is basically a half inch, and I'm going to show you how to do it today. Okay, so what you're gonna start with now is make sure these two are together. You're gonna start the base. You're gonna get your half-inch tape right here, right around right there. Make sure it's nice and not, wrinkled or has bubbles at all. Making sure it's a nice base going around about 3 times. Okay. Make sure it's ripped, nice and easy, perfect. Yep, going around. Got 3 exact times. Make sure it's on there. If you want to, again, you can put gauze in there, but we don't have that right now. The athlete doesn't prefer it. Okay, then you're going to do is grab the other half inch of the tape. Go more towards the front. This allows the two fingers to be together. Going around 3 times. Make sure the fingers are nice and tight and still have flexibility. Okay, what you're going to do, boom. And as you can see, she still can bend her fingers, right? So she still has breathability enough to move her hands when she runs. But there you go. There's buddy taping right for you. So today what we're doing now is a wrist taping. They're going to have your hands spread out so the wrist pops up a little bit where it needs to be. You're going to make sure that, you can use pre-wrap around the wrist. It makes it more comfortable, but today we don't have it. So what you're going to do, you're first going to do nice and easy. Make sure it's there. You're going to go around once. Okay. You're going to rip it. Make sure it's good. You can go around again. Just a little bit at an angle, always at an angle. Going around just to make sure that the wrist is getting a good base. That's 2. You're going to go 3 times as a base just to start it off. Going around. Boom. There's your 3 bases. Okay. What you're going to do now is go more of an angle now again. Right here. And once you go under, you're going to pinch the tape a little bit just so it doesn't squeeze there and come in. Nice and easy. If you go too hard, it's going to be uncomfortable for the athlete. What you're going to do is rip. You're going to put it right there. Making sure that there is still stability and none there. You're going to go again around here. Now we're just filling in. Again, I like to make sure that you're ripping after each one. Okay. Boom. One more time around here, making sure that we're pinching the tape through here so the athlete doesn't feel too much pressure on the hand. Boom, going around. Boom. That the athlete can still move the wrist up and down. Close the wrist, go down. Still stability, still good to go. Okay, so today what we're doing is just an average shin taping. As you can see, we have her leg at an angle. The next thing to do would be to make sure her foot goes up. Relax for now though, once I explain a little more. So what we're going to do, if the injury is in here, then we can tape the ankle, compress it. Our goal is to compress the injury. If it's up here more, then it'd be more of a problem with the calf that can cause into cramping, okay? So what we're first going to talk about is where to start at a base. Usually what you would do is put pre-wrap around there and then go from there. Always, the big part about this is about angles. What we're all going to do, we're going to start here, okay? And what we're going to do is go at an angle, and we're always going from underneath so that it's less chance of cramping. And what we're going to do, always be tearing it after each time. And we're going to be going at an angle at all times. And you're always going about 50% on, 50% off of the recent tape. And we're going at an angle. And again, if you go too tight, it can cause cramping and the athlete's injury. So what you're going to do is go at an angle, always going at an angle. And once you get that couple times through, boom, you got tape there. You're gonna make sure that there's no bubbles, no ankles, nothing. And then we're gonna finish off, making sure that every angle is correct, everything's taped correctly, and it looks proper. And making sure that it's not too tight on the athlete, because again, the calf can cramp up. As you can see, the calf can cramp up, but it looks just nice right there. Okay, so this is next taping. It is just a normal ankle tape. Most sprained ankles happen because the foot goes inward, and so the pain is right here. And what you would usually do first is you have 2 adhesive pads going, one on top, one on the bottom, to help keep everything stable. And after that, you would do pre-wrap. But today we just have the ACE tape. So what we're going to do is we're going to skip the first 2 steps of the adhesive pads and then the pre-wrap straight into here. What you're going to do first is basically you're going to get one here, not too high up, just because you want to make sure that the toes don't cramp up. And what you do is go around here once, just like this. You go around right there, boom. Then you would go one up here, just to make sure. And again, if you do have pre-wrap on here, make sure a little bit of the tape gets onto the skin if there's a sweaty athlete. You can go around here twice, so one right here, just once, boom, boom. And then you go a little bit lower, just like that, get twice, boom, nice and easy. And what you're gonna do now, since it is the outward, you're gonna make sure, we're to make sure that pain goes away, we're gonna make sure that pulls. So we're gonna start from the inside of the foot here, right there, boom. You go around the heel, right into right here. What you're gonna do, you're gonna rip it and make sure you have it right there. So, and make sure it's nice and comfortable, not too tight. Again, we don't want the ankles to chip. And then what we're gonna do after you do that, kind of filling in. Again, just around these areas, just to make sure it's nice and stable. Make sure, boom. Again, this does happen. Just make sure the tape is nice and easy afterwards. Everything's fixed. Boom, perfect. Right, boom. Again, you're gonna have to at least do 2 wraparounds from the inside. Boom. Again, with smaller athletes, you can get away with 2. With bigger athletes, you're gonna need at least 3. Boom. Okay, after you do that, you're going to fill in, just to make sure everything's nice and, again, stable with the athlete's foot. As you can see, my angles always change. Again, with angles, you're going to start this way. Boom, boom, boom. As you get closer, it's going to start turning this way. I'm running out of tape. We're okay. We're still good. Boom. Okay, and around there we go. I'm out of tape real quick and get the next roll. And we're all good. One more just to make sure. Here we go. And once you do this, you just want to make sure that everything's nice and secure and good to go. The last tape right here, just to make sure that we're all good. Boom. Okay. And this last one right here, just to make sure that we're good. Boom. Perfect. And as you can see, the ankle is tied perfectly with no bumps, no air bubbles. Everything's good. Boom. So what this is called is an arch taping. The arch taping is used when there's pain in the arch or the heel, or lower end shin splints. Then you use pre-wrap first, and then you want to build a base. The base could be with stretch tape or ACE bandage tape. What you're going to do is you're going to start off by using 1 inch, go around here, starting point. What you want to do is make sure you go on the heel, not too high. And what you're going to do is make sure it's ripped here, around the heel, boom. What you're going to do is you're going to get a little bit closer and closer every time as an angle. All right, so they go here next. Go here next. Boom. What you're going to do is go around the heel, making sure everything's tight. Everything's good. All right. Around the heel. Yep. Boom. Making sure everything looks good. You can do about 3 of these. As you can see, the angle changes every time, making sure we're going around the heel. Boom. You can see it's cheap tape. Going around the heel. Boom. Okay, boom. And then what you're going to do is you're always going to go in and out. Boom. Boom. And then there you go. All done. So you can see the arch is all good. It's all good to go. There you go.